I'd like to welcome you all to the third installment of the Own Your Health monthly talks from medical experts within St. Paul's Hospital. And tonight's talk is Let's Talk About Heart Disease. My name is Scott Lear. I'll be your moderator and keeping everybody under control for the evening. And I've been part of the Healthy Heart program since 1996. And at that time, I had a bit more hair than I do now. And I've worked for the last few years with both of our speakers and know them well, and I'm quite pleased to have the opportunity to introduce them. So first off, I'd like to introduce Dr. Gordon Francis, and he's actually a brain gain we've had recently from Alberta to BC, and probably tonight, he's happy to be in Vancouver because we have a better hockey team than those in Alberta, although I'm not sure if I can get updates through this computer here. But Dr. Francis is a professor of medicine in the Division of Endocrinology and Metabolism at UBC. He's the director of the Healthy Heart Program Prevention Clinic, so he's well-versed on the topic. The director of the Heart and Stroke Foundation of BC and Yukon Lipid Research Laboratory, and these are both located at St. Paul's here. He holds a number of research grants from the Canadian Institutes of Health Research, the Heart and Stroke Foundation, and Pfizer Canada. His research involves understanding the mechanisms of the formation of HDL, the good cholesterol that helps us out, in order to develop new therapies to increase HDL so that we can look at other avenues for preventing and managing heart disease and stroke. He also performs research in a clinical setting. He has a clinical practice, which is really advantageous, doing research, bringing research to patients and vice versa. And so he's going to be talking about common risk factors for heart disease. So please welcome me and welcome Dr. Francis to the podium.
We already know most of the things that cause heart disease. So and the good thing is that most of them are preventable. So that's good news. And if you reduce your risk for heart disease, you're also reducing your risk for diabetes, hypertension, kidney disease, lung disease, cancers even. So working on things that reduce your heart risk factors help prevent many different diseases. So I'll give a relatively brief presentation, and then Bonnie will speak about smoking cessation, and then we'll both be happy to take lots of questions. So most of this should be interactive, so please think up and send in your questions. So the title of my presentation is Heart Disease Prevention is Disease Prevention. So that's very sincere in that when you do things that reduce your risk for heart disease, you're protecting your health generally. So the bad news about heart disease is that it is the leading cause of death in our society still, even higher than cancer still. And it's a disease of aging, but many risk factors can impact to cause it to happen earlier. It's also the largest reason for the big burden of healthcare costs. So if we do things to reduce heart disease, then we'll be reducing our tax bill as well. So the process of hardening of the arteries, or atherosclerosis, takes place over a lifetime, and you can see in this diagram it's a buildup of cholesterol and cells in a part of the artery that normally doesn't have any of those things, and that reduces blood flow. But even if you have a 20 or 30% blockage of your, say, a coronary artery, it can form a blood clot that blocks the whole artery and can lead to a heart attack. If some of this flies off, or if you have hardening of the arteries in your brain, that also is the main cause of strokes. Or if you have blockages in the arteries leading to your legs, you get pain in your legs when you walk, and we call that peripheral vascular disease, and that can result in poor blood flow and sometimes amputations. So combined, these are by far the leading cause of death, and not just in Canada, but all over the world now, even in so-called developing countries. But the good news is that most heart disease is preventable, and we already know the causes of heart disease. This is different from, say, cancer, where we don't absolutely know what are the major risk factors. We do know for heart disease. And by doing things that reduce your risk of heart disease, you also reduce your risk of getting diabetes, high blood pressure, being overweight or obese. Particularly if you quit smoking, you'll have much less lung disease. If you get diabetes or if you have hardening of the arteries, those are risk factors for kidney disease. If you're overweight, that's a risk factor for arthritis. And many things that cause heart disease are also associated with increased risk for cancer, such as obesity and smoking. So if you work on reducing heart risk factors, you'll be healthy generally. Some of the things you can't do anything about that are risk factors. Just getting older is a risk factor for hardening of the arteries. Most of us don't want to change our gender, but even if you did, it probably wouldn't reduce your risk of a heart attack. So that's not a good way to prevent heart disease. You can't pick your parents, unfortunately, and family history is a very strong predictor of who gets heart attacks and strokes and things like diabetes. Your ethnic origin may predispose you to some diseases, including diabetes. And if you've had a heart attack or stroke already, you can't do much about that, but you can reduce your risk very greatly of having a second heart attack or stroke. So just about family history, what matters most if you're talking about disease in your family and how it would affect you? We say that there's early heart disease in families if your mother or father or one of your siblings has had evidence of heart disease or an actual heart attack or stroke before the age of 60. So if your mother or father had even starting to have chest pain, for example, that was due to coronary heart disease before 60, or they had a heart attack or stroke before 60, we call that early, or if that happened to one of your siblings. And if that is the case, then that leads to a doubling of your risk for heart attack or stroke. So we look at family history very carefully when we're assessing people's risk for heart disease. And you don't have to have died from it before 60. Just starting to have symptoms is enough. Another thing that runs in families is type 2 diabetes. So if one of your parents or one of your siblings has developed type 2 diabetes, you have about a 50% chance of getting it during your lifetime as well. So that's actually very useful information because diabetes can be prevented by regular exercise, for example, is the best way. So by knowing that there's diabetes in your family and knowing you have an increased risk for that, you can do things to help prevent it. So what are the major risk factors for heart disease that are modifiable? There was a big study published about 6 years ago now looking at 15,000 people having their first heart attack, equal numbers of men and women, all continents of the world, every ethnic group. And the strongest predictors in order were the ratio of bad cholesterol over good cholesterol, smoking, stress, diabetes, high blood pressure, and belly fat or abdominal obesity. So, and these things accounted for about 90% of our risk. So, unfortunately, these are all things we can do something about. So just going through each of those quickly, the bad cholesterol particles are the LDL. They deliver cholesterol to your arteries. And the HDL is the so-called good cholesterol fraction. And the reason we think it's good is because it acts like a vacuum to pull the bad cholesterol out of the arteries. It probably has other protective actions. It reduces inflammation. It reduces blood clotting. But regardless, it has multiple beneficial effects. So we attempt to help people lower their bad cholesterol and raise their good cholesterol. A lot of people have genetically high cholesterol, about 1 in 40 people. And when do you know that your high cholesterol might not be your own fault? This is something we talk about a lot in our clinic. If your total cholesterol is higher than about 6.5, or if your LDL is higher than about 4.5, or if your triglycerides are more than 3, or if your HDL is quite low, less than 0.7. So these conditions are fairly common. People might work on their diet, be doing a very good job, eating a healthy diet and exercising regularly, and they still have high cholesterol, or they still have low HDL. And they think they're a failure and they're a bad person and it's their fault. But it isn't. It's your parents' fault. So blame them. And in that case, sometimes you can't normalize your cholesterol just by being a good person and eating healthy and exercising regularly. So you shouldn't blame yourself if you were born with one of these conditions. They are common, but fortunately we now have good ways of treating them. If you're going to be born with something, this isn't actually one of the worst things to have. Smoking is a major risk factor for heart disease, as Bonnie's going to talk about further. Smoking does many bad things to your arteries. It causes them to constrict, so there's poor blood flow to the tissues. That's why when you see a smoker, they often look kind of purplish because they have too much carbon monoxide buildup in their tissues. It damages the lining of your arteries, and that induces the formation of plaques, and it can cause blood to clot more readily, and it reduces HDL level, and plus but the good thing about quitting smoking is that the harmful effects disappear actually very quickly. And within about 2 years of having quit smoking, your risk of heart attack goes back down to that of a non-smoker. And your risk of lung cancer takes longer, more like about 15 years. But you get the benefits of quitting smoking quite quickly. Stress we often talk about as a risk factor for heart disease. And when it was quantitated using validated questionnaires in that large study that I mentioned, it was found to be the third strongest predictor for risk for heart disease. So we often hear about somebody who's lost their spouse, for example, and then they have a heart attack because they're under a lot of stress. So it's not something we're that good at measuring, I would say. But we ask people how stressed they feel, how anxious, and are they depressed. The way that stress worsens risk for heart disease isn't exactly clear, but if you're under a lot of stress, your body's making more cortisol and adrenaline, and that can lead to increased damage to blood vessels. So reducing stress is a major factor in reducing heart disease risk. Diabetes, we've known for a long time, the main thing that people who have diabetes die from is coronary heart disease or heart attacks. And so people with diabetes have about a 2 to 4-fold increased risk of having a heart attack, and if they have one, they're more likely to die from it. And we know that some of that is because their cholesterol particles are changed, and their LDL become even more harmful. And some recent studies show that if you have very strict control of your blood sugar, that doesn't necessarily reduce your risk of a heart attack, but it does reduce your risk of eye, kidney, and nerve damage. So it's still a good thing to try to keep good control of your blood sugar if you have diabetes. The best thing is to try to avoid getting diabetes in the first place. High blood pressure is a major risk factor for heart attacks. It causes damage to the lining of your blood vessels and causes thickening of the blood vessels, so your heart has to pump harder against the higher pressure, which damages the coronary arteries. But the good thing is you can reduce your blood pressure with lifestyle measures, including reducing your salt intake. Just by starting to exercise, people see a drop in their blood pressure. By losing some weight, your blood pressure will drop. And all of these things work just about as well independently and individually as taking medication to reduce your blood pressure. So I like to show this because depending on your beliefs, it took maybe millions or thousands of years for man to go from this shape to this shape, but it's only taken about 40 years for the average shape to change into something like this. And it's not inevitable, because we live in this high-tech society where we don't have to hunt and gather to get our food and that we're all going to be overweight. I think that's not the case, and if we think about regular exercise and healthy diet, we don't all have to look like this. And you don't just have to be on 10 different pills to help you avoid the ill effects of this shape. So, but when people have increased fat in the belly in particular, that type of fat seems to be more dangerous than fat that builds up on other parts of your body. And the fat around the intestines in particular seems to release more inflammatory mediators that can damage the artery walls. And so we know that people with increased abdominal fat have a higher rate of heart disease as well as risk for diabetes. And this increased waist circumference is part of the definition of the metabolic syndrome. And this is associated with increased risk for diabetes and also developing a fatty liver. So, what are some good ways to avoid heart disease? A healthy diet is very important. Just eating fruit and vegetables every day reduces your risk of heart disease by about 30%. So it's a big predictor. And people who have 5 fruit and vegetable servings per day by itself have a major drop in risk for heart disease. So, and this can be, like 3 pieces of fruit and 2 vegetable servings or 5 vegetable servings or however you like to have it. And other things, general tips about diet, and I'm no dietitian, but just spreading your food out well throughout the day. Don't skip meals. And lately I've been hearing from dietitians and other that we should all be eating 60% of our calories before 4 p.m. So having a bigger breakfast, bigger lunch, and smaller dinner is a healthy way to eat. It's not what most of us do, but so take the time to eat a good-sized breakfast in particular. And generally limiting red meat, baked goods, and too much fat. And then another good way to avoid heart disease and also diabetes is to do some kind of exercise daily. Exercise, and this can be just walking. It doesn't have to be going to a gym for an hour, 7 days a week. Just walking for half an hour a day is a major beneficial factor for reducing blood sugar, reducing your chance of getting diabetes, reducing your blood pressure, and reducing your cholesterol. It may or may not help you lose weight, but even if you don't lose weight by doing regular exercise, you reduce your risk for heart disease and diabetes. So the recommendation is to try to do something every day of the week. So it's better to do 30 minutes of walking each day than to do an hour of walking 3 days a week, for example. So, and regular exercise is better at preventing diabetes than taking a pill like metformin. It's about twice as good. And so our recommendation is that people try to do at least 30 minutes a day. If you prefer to do 15 minutes twice a day, that's good. If you can do more, that's also good. So in summary, we know what causes heart disease. High bad cholesterol, low good cholesterol, smoking, stress, diabetes, high blood pressure, abdominal fat, low exercise level, and an unhealthy diet explain about 90% of the risk for heart disease. You can't do anything about your age, your parents, your gender, but you can modify these things. And if we did those things, we wouldn't be seeing heart disease as the number one cause of death. So I work on studying how we can raise the good cholesterol, HDL. Lifestyle things you can do to help raise your HDL include aerobic exercise, quitting smoking, losing some weight. If you're diabetic, getting good control of your blood sugar. And the best thing we have from a treatment standpoint is the vitamin B3, niacin. How many of you have taken niacin? So what's the main side effect of niacin? Flushing, right. So I don't recommend that you all go out and buy a big bottle of niacin and take it tonight, because you'll wake up in the middle of the night totally red and go to the emergency room. So that's not the recommendation, but with your doctor's advice if you're going to try that. So we're looking at ways we could try to raise HDL in the lab and then hopefully turn that into therapies for people. And we're looking at different protein therapies that turn on HDL formation, increasing the cellular pump that makes HDL, and removing more cholesterol from arteries by turning on HDL formation. So our clinic is called the Healthy Heart Program Prevention Clinic. We changed the name 2 years ago from the Lipid Clinic. Although we are experts in cholesterol disorders, we do a lot more than just manage cholesterol. We look at all the aspects of heart disease. And we're a unique clinic in the province. We're actually the largest clinic of this kind in Canada. And so we look at all of the major risk factors that people have, and we try to help them manage those. And usually we like to have a referral from your family physician. So my last slide is that heart disease prevention is disease prevention. If you do things that reduce your risk for heart disease, you also reduce your risk for getting diabetes, high blood pressure, obesity, lung and kidney disease, arthritis, and even cancer. So thanks for your attention, and I'll stop there and let Bonnie come to the podium.